I'm going to talk to you about a problem that women are very embarrassed to talk about, or even admit they have, which is laughing and then leaking some urine. Besides the medical problem, it's a very big social problem because they're embarrassed to be leaking urine. If they are wearing incontinence pads, they're embarrassed to have someone near them smell what they smell like. And so it really kills the quality of their lives. What we've developed is a way of giving these women their life back. Childbirth, and it was first treated 3,500 years ago by the ancient Egyptians, who developed papyrus for writing and then used it for incontinence pads shortly thereafter. As you can see, developments have been continuous over thousands of years, and nothing new has really been happening since Arnold Kegel invented Kegel exercises in 1948. Floelle has a medical device that goes in the urethra and stops leaks. It doesn't require changing 10 times a day like pads. It doesn't require surgeries, it doesn't require drugs. It fits into the lifestyle of a busy woman. Right now, the surgery for incontinence has engendered 72,000 lawsuits being settled for $3 million apiece, or $210 billion of lawsuits against the surgical devices. So we've developed something that's non-surgical, that fits into the life of a busy woman who's got kids sometimes to take care of, a husband to take care of, her own job to take care of. Doesn't have time to be changing pads 10 times a day. There are also now accessories that go in the vagina and push up against the urethra that cost about $8,600 a year, available at Walmart. So we want something that's easy, that's safe, and that's worry-free. You don't have to worry about carrying an extra pair of clothes in the car in case they get wet from the day. So we've invented the Floelle device to solve this huge problem. It's a common problem that affects younger women, but since it's the result of childbirth, it often occurs with women who are older. And sometimes the damage from having a child shows up 20 years later. It's a very big problem that needs treatment. The solution is a device that goes in the female urethra and stays there. It's treated with antimicrobials, so it kills any bacteria that try to grow in the device. The antimicrobials last about 4 months, and so it protects the woman from any kind of infection that the device would have. And it fits the needs of the patient and the doctor. The patient gets protected and is kept safe. The doctor gets continuing revenue. Every 4 months they have to put one in, take one out. The device itself is very small. It fits on the end of an insertion device. This is put into the urethra, and then this is withdrawn, leaving just this very tiny, very soft silicone rubber device. It has a clear channel the woman can urinate through it, and when she sneezes, it shuts like that and it stops the leak. So it's as simple as a thermostat, the old bimetal thermostats that when flipped up when it got hot or cold. How does it work? Well, if the woman sneezes, maybe not. Anyway, this should be a 3D simulation. You can see it by our booth of the device closing during the sneeze and then opening after the sneeze. We have the right team. Our chief marketing officer is here, Sarah. Our chief financial officer is here, Peter. And the inventor is Sherry, or co-inventor, I should say. And we also have a support team that advises us, who are head of urology at a local clinic. To go to market, we're not going to introduce it all at once. We'll introduce it in regions of 60 million people in the U.S. and in Europe. So we'll start with 2 regions here, 2 there. The next year, 2 more, etc., until we cover the whole U.S. and Europe. The financials, we have no revenue the first 2 years while we are going through the process of clinical trials and getting FDA permission to market. Once we have that permission, then we will get some revenue right away. And then the revenue builds quickly because in addition to having more sales in the same region, we have new regions that we're adding in to generate sales. We will hopefully exit in 5 years. Some of the potential acquirers are listed here. We've talked to some of them, and they're quite interested. If you want to get a hold of me, there's my contact information. We're also at the booth on the side that says Floelle. Thank you very much for your attention. I'll take 2 burning questions. Yes.
I have a question. So can you say anything about the antimicrobial that you're using?
Yes. It's a silver ion inside of a ion exchange solid called the zeolite. It's developed here in Wakefield by Adrian Technologies. And it's used in central venous lines for 10 years. So it's very safe and very effective. Second question? You went into that? Yes, sir.
You survived the valley of death.
That's the challenge. We developed the product to the point of having a working prototype, and we're now raising $100,000 so we can do a first-in-human study. And with that data, we hope to convince investors to invest the $1.1 million it takes to do the clinical trial and get it to regulatory approval.